what side effects do people or can people expect from egg freezing? So the first thing is when we're giving you medications to grow all of your eggs in your ovaries, those eggs will start to produce estrogen. And the female body likes estrogen. And so oftentimes people feel really good during this part of the process. Occasionally, people will experience bloat. The other thing is that your ovaries do start to get big, right? Because instead of growing one egg, we are growing all of them released that month. And so that can cause just bloating in general. Really, the side effects you don't really start to see potentially until after the retrieval. So when you go in for a retrieval, we use a needle. So it's a transvaginal ultrasound and a needle on the inside. So we are going through the vaginal wall into the ovary to retrieve the eggs. When you wake up, you really shouldn't be in pain. Everyone's experience is different, but it is usually fairly painless. You might have some cramping, but then in the days following the egg retrieval procedure, sometimes the bloating can get worse for about 3 days, but usually all of those symptoms resolve by the time that you start your period, which is usually around 2 weeks after the retrieval. So a lot of people are afraid of weight gain or mood changes. Again, everyone's experience is different. Really, the biggest thing though is bloating, and any weight gain is usually water. That does resolve by the time your period comes 2 weeks after the retrieval. So another question is, does my cycle go back to normal after I do egg freezing? So after the egg retrieval, you will have the follicles that we retrieve from turn into what's called corpus luteums, and they all produce a little bit of progesterone. Those corpus luteums are really damaged because we've stuck a needle in them, but the progesterone will last for about 14 days usually, and then it'll stop producing. And so when your body sees that drop in progesterone, you will get a bleed. Some people say that their period is a lot heavier their following period, and usually that's because you have a lot of estrogen, and so that estrogen grows the lining pretty thick. And so the period after, it may not be exactly when you would normally expect it. So if you use a period tracking app, that's probably not going to be correct because we are controlling your cycle. And so I would expect it around 2 weeks after your retrieval and a little bit heavier maybe of a period. And then from there, your cycle should regulate itself.